Hello class. In this video, I'll be talking about chapter 4 on aging. The aging chapter provides an example of how a change in demographics influences healthcare needs. As people are living longer, their needs will change. This chapter reviews health problems for the older adult population, such as instrumental activities of daily living and activities of daily living. Then the chapter will describe two federal programs which pay for care for older adults, Medicare and Medicaid. Note that there are some older adults who are low income that may qualify for both Medicare and Medicaid, and these folks are known as dual eligibles or Medi-Medi. The next section of the chapter focuses on the types of services for older adults and the various settings that these take place in. So these can be categorized as long-term services, community long-term services, and other community programs. Please pay particular attention to this section so that you can see the variety of settings you could work in the future that take place outside of a hospital. Lastly, the chapter concludes with how the aging population is also increasingly more racially and culturally diverse. It's important to note that not only will older adult patients require more assistance with their daily activities, chronic diseases, and mental health challenges, but that all of these issues should be handled with cultural competence by health professionals. In particular, I think about my grandpa who was hospitalized a few years ago with pneumonia at the age of 96. After the infection, Lolo, which is Tagalog for grandpa, had difficulty speaking. He was barely audible as he tried to utter ano mero. Was he trying to speak English, Tagalog, or his native dialect of Sambal? He was actually trying to say anong meron, or what is there to eat? Because my family was by his side, we were able to interpret that anong meron was what is there, but what if we weren't there? Would linguistically appropriate services be available? Culturally, the decision of which procedures to approve required health literacy on the part of my mom and her siblings. My mom, as I mentioned previously, worked in the hospital. But even with her background, and even with my master's in public health, older adult issues weren't something that we were familiar with. So I actually sought out journal articles and asked colleagues on Facebook about some of the procedures that the physician recommended to help my grandfather. But ultimately, the care team that was working with my grandpa did not present the options for care with an understanding of what our family valued. So ultimately, we ended up bringing him home, kind of confused about what had been prescribed, and sadly, we laid him to rest a few days later. So the reason why I'm sharing this story is that cultural and linguistic competence is necessary throughout the life course, but particularly with vulnerable populations such as older adults. And so throughout this course, I hope that you will think about how the content we're studying connects to your own experiences, as well as how the content relates to society. There's a lot that we're going to cover in this class as it relates to different careers and even just the healthcare system overall. But what I hope you take away is how this can help you make more meaning out of your own experiences, as well as connect to your future careers as health professionals and the impact that you can have in creating a healthier world.